Bioethics is the study of values and beliefs and morality as it applies to biology and everything that comes between. So you could have anything from clinical research and stuff that's done in a lab to the actual provision of medical care for a person on the clinical side of things, and then everything in between. It could be social public policy, it could be social structures issues as well, but that to me is bioethics: values, beliefs, morality with biology and the study of the human person. And then when you get into medical ethics, that's specifically in the healthcare aspect of that and that care delivery portion there. What I liked was the relationship, the experience that you have helping people make very difficult decisions, life-changing decisions, and being invited into that space. There's something special and sacred about that. Here I am talking to a complete stranger about the very intimate details of their life and their beliefs and the core of who they are as a person. And I may not ever see them again, but I get invited into that space. There's something special about that I really liked and appreciated and grew to love probably more than I ever thought I would. It can be very difficult work on an emotional and a spiritual level. You need a strong spiritual grounding to where you know what your core is, what your values, your beliefs are, so you can come back to that. Because you're going to be pushed, you're going to be tried, you're going to get to the limits. And if you don't have that strong grounding to come back to, it makes it really difficult on a personal level to deal with this. I had really good mentors. I had people who kind of took me under their wing and helped me walk through, and I could call them and talk to them about stuff. And that was really helpful. Some of those relationships have been going on for, almost 20 years now for me at least. And that's been really core to have. And especially if it's someone who, maybe not in your organization, especially you can talk to and bounce ideas off of and talk through stuff. It's a small community. We talk to each other all the time. I'll regularly call up colleagues in other health systems and say, hey, I encountered this issue. Have you encountered that? How did you deal with it? And that helps me then answer these questions that I have here. And I have colleagues who are a nurse primarily, or a physician, or an attorney, and they have their areas of expertise, and they'll call me with philosophy questions, right? And so we lean on each other, not just for the personal friendship, emotional aspects, but also the technical knowledge as well.